Hello guys, welcome to SKK classes NZ again. So in our previous videos we have discussed about the jaundice, what are the main signs symptoms of jaundice and what are the main causes of jaundice, that why the jaundice will always occur. So today we are going to focus on the treatment plan as well as the types of jaundice, that what are the main types of jaundice and what type of treatment that should be provided to the patient according to the condition of the patient. So let's discuss about the types and treatment of jaundice. Before starting the types of jaundice, it's very much important that we should understood the pathophysiology a little bit, so that it can be easy for us to understood the types of jaundice. Okay, so all of you know that the jaundice that results from the high level of bilirubin. Okay, if it is present in the blood. And what is bilirubin? Bilirubin is a you can say normal breakdown product from the metabolism of heme. Heme means that like hemoglobin. Okay, and it's formed from the destruction of RBCs. Okay, so means when the red blood cells break down, okay, in that situation what will happen, the bilirubin level that gonna increase in our blood. Okay, that will leads to you can say jaundice or hyperbilirubinemia. Okay, hyperbilirubinemia means hyper means increased amount, bilirubin refers to bilirubin pigment, and emia word refers to in the blood. Okay, so this is what is known as jaundice and hyperbilirubinemia. I mean to say that if this pathway, okay, gonna disturbed, then the formation of jaundice or the jaundice will be there, and you can say the high bilirubin that will be present in the blood, because mostly the bilirubin, if there is any breakdown of red blood cell is there, so mostly what happened, the bilirubin that will excreted in the GI tract via bile. Okay, and that will be you can say removed out from the body through the fecal matter. But if this track or this pathway gonna disturbed, then 100% chances are there that the patient will gonna will be suffered from jaundice. Okay, and how this pathway will be disturbed, for example, that I already cleared you, that bile juice that is produced by liver, and where the bile juice will get stored, it is stored in the gallbladder. So whenever the body needs you can say bile juice, so for the digestion of fats, so in that situation gallbladder always release the bile juice. But if there is some problem in the gallbladder, I mean to say, if suppose if there are stones are present in the gallbladder, or patient is suffered from you can say cholelithasis. Okay, so what happen in that situation, the condition will gonna change, and this pathway will get disturbed, because the bilirubin will not be excreted out through the fecal matter and out from the body. Okay, so this that's why I already cleared in my first video that jaundice is itself not a disease, but jaundice always occur with some underlying condition. That underlying condition can be any. It may be gallbladder stones, it can be some liver disease, suppose if there is a so jaundice is itself not a disease, okay, which it always occur with the underlying condition, and underlying condition can be any. It can be gallbladder stone, it can be the disease of liver. Now let's discuss the types of jaundice. There are three types of jaundice are there. Number one is a pre-hepatic jaundice. Number two is a hepatic jaundice, and number three is post-hepatic jaundice. What is the difference between these pre-hepatic, hepatic and post-hepatic jaundice? First, we will discuss pre-hepatic jaundice. So, what happened in the pre-hepatic jaundice? If there is suppose a excessive red cell breakdown is there, and it causes an unconjugated hyperbilirubinemia. So, I already cleared that bilirubin that will be excreted out from the body through the bile tract, okay, you can say through the gastrointestinal tract. But if there is some problem in the gallbladder or in any liver, okay, so what happened in that situation, the bilirubin will not be excreted out from the body, so and its level gonna high in the blood, and it the patient will suffer from jaundice. This is what you mean by pre-hepatic jaundice. Means the bilirubin has not entered in the liver. Okay, it is just in the GI tract or in the you can say bile tract. Okay, and just only the red blood cells break down there. This is known as pre-hepatic jaundice. Next one is your hepatic jaundice. Now, what is hepatic jaundice? So, what happened in the hepatic jaundice? Hepatic word always refers to liver. So, here what will be there? The dysfunction of hepatic cells they are there. Means liver is not working properly. Okay, and liver loses the ability to conjugate the bilirubin so that it can be excreted out from the body. Okay, means the main thing, okay, the main part, liver, which is able to conjugate the bilirubin so that it can excrete it out from the body, that is having a problem. Liver itself having a problem. That's the main reason that bilirubin will not get excreted from the body and its level gonna high and the patient will suffer from you can say jaundice. So this is what you mean by hepatic jaundice or hepatocellular jaundice. Something more that here I would like to clear. If you people are having some like confusion regarding conjugated and unconjugated bilirubin, I would like to clear. You can say the conjugated bilirubin is that bilirubin that can be excreted via urine. Okay, because it is water soluble. Okay, and unconjugated bilirubin is not water soluble and it can't be you can say excreted out from the body. Okay, and most probably if the conjugated like this jaundice is there, the patient always produces dark Coca-Cola, okay, colored urine. Mostly this is the main sign symptom. I'm just going to clear you. Dark Coca-Cola, like the color of Coke, that type of urine will be secreted or produced by the patient mostly. Okay, and if I'm talking about lab investigations, that what type of lab investigations that we have to follow or we have to do to rule out the jaundice, that LFT, that is liver function test from the okay, and serum bilirubin, blood urea, okay, all these tests that always included in this. Then apart from this, doctors always gives the order to reveal the CBC, LFT. Okay, so these types of like a test that should be followed just to rule out the jaundice. When doctor will see that the condition is quite severe, so in that in the advanced, and it is in the advanced stage, so they will always prescribe the youth just to go for the MRI, magnetic resonance imaging, or ultrasound of abdomen, so that they just know that what is the main reason behind the jaundice. Okay, is it a pre-hepatic jaundice, is it post-hepatic jaundice, or it is any other condition, just to rule out that what is the main cause of jaundice. Okay, because if the cause will not be cleared, the doctors will not be able to you can say treat the patient properly. So just to treat the patient properly, the rule out of that what type of jaundice is there and what are the main causes of jaundice will be there, that is must. And in severe cases, if loss of you can say breakdown of RBCs is there, so it's normal that HB level, that hemoglobin level, that will decrease from the normal limit. So in this condition, the patient blood transfusion that should be provided to the patient. Okay, and if there is a main cause of jaundice is some obstruction, suppose patient is suffering from cholelithiasis plus jaundice. Okay, so what will be the priority? First, we doctors always try their best just to rule out the supportive care for jaundice. Okay, so that the condition will not gonna severe. They will start side by side the antibiotics, plus they will also rule out the cholelithiasis. If the gallbladder stones are there, so they will try, or they will you can say advise the patient to go for surgery. Okay, so that the gallbladder stones that should be you can say gallbladder should be removed so that the jaundice can be decreased. If I'm talking about the treatment, so most probably the treatment factor that depends upon the type as well as the cause of jaundice. That is I already cleared you that jaundice treatment that depends upon the cause plus type of jaundice. Okay, and mostly it includes supportive care and antibiotics that should be prescribed by the doctor, that should be given to the patient. And if the patient is like a no, regular user of alcohol, so he or she has to stop the alcohol, because always alcohol always trigger the jaundice factor. And in severe cases, if loss of you can say breakdown of RBCs is there, so it's normal that HB level, that hemoglobin level, that will decrease from the normal limit. So in this condition, the patient like blood transfusion that should be provided to the patient. Okay, and if there is a main cause of jaundice is some obstruction, suppose patient is suffering from cholelithiasis plus jaundice. Okay, so what will be the priority? First, we doctors always try their best just to rule out the supportive care for jaundice. Okay, so that the condition will not gonna severe. They will start side by side the antibiotics, plus they will also rule out the cholelithiasis. If the gallbladder stones are there, so they will try, or they will you can say advise the patient to go for surgery. Okay, so that the gallbladder stones that should be you can say gallbladder should be removed so that the jaundice can be decreased. So this is all about jaundice, signs, symptoms of jaundice, types of jaundice, pathophysiology, as well as the treatment plan. So I think now it should be very much clear to all of you that what is jaundice. Okay, if you're talking about the diet, that what type of diet that should be provided to the patient or person who is suffering from jaundice, that we can do at our own level, that we have to you can say advise the patient or person to drink lot of water. Okay, just to flush out the toxins. Okay, then ginger, that is also good for the patient. Then papaya, beetroot, and berries. So these are the main fruits that or food that can be included in the diet of the patient. If you're talking about the diet, that what type of diet that should be provided to the patient or person who is suffering from jaundice, that we can do at our own level, that we have to you can say advise the patient or person to drink lot of water. Okay, just to flush out the toxins. Okay, then ginger, that is also good for the patient. Then papaya, beetroot, and berries. So these are the main fruits that or food that can be included in the diet of the patient. And in our next video we will discuss about that what type of food we have to eat and what type of food that we have to avoid if we are suffering from jaundice. Okay, so till then, thank you for watching SKK Classes NZ. And don't forget to subscribe my channel. Thank you.